Traditional client intake assessments often feel like cold interrogations that inadvertently trigger trauma and reinforce institutional power imbalances. In this video, we will learn the exact 8-step framework to transform your social work intake process into an empowering, equity-driven dialogue that builds deep trust from minute one. Before we dive into step one, if you want to follow along and streamline your documentation using the exact inclusive forms we feature today, click the link in the description below to grab your free 21-day trial of Case Management Hub. Over the next few minutes, we're going to break down how to unpack hidden power dynamics, audit pathologizing paperwork, redesign your physical and digital intake spaces, and ask questions that highlight systematic obstacles rather than client deficiencies. Whether you work in a community health center, school, or private clinical practice, these actionable strategies will help you co-create care plans rooted in dignity, continuous consent, and genuine client autonomy. Let's step right in. Welcome, everyone. I'm glad you're joining me today to take a look at how we approach the social work intake process through a lens of true health equity. An anti-oppressive practice framework in human services actively identifies and deconstructs structural inequality within clinical and community settings. Too often, conversational intake forms reduce human beings to a checklist or vulnerabilities and diagnostic codes. Today, we're shifting the paradigm so your first interaction with a client feels safe, collaborative, and human-centered. By the end of this video, you'll have a clear blueprint to audit your current procedures and implement immediate, high-impact changes. Addressing inherent power dynamics in social work requires acknowledging our agency authority before asking a single personal question. During a trauma-informed intake, clients often arrive feeling anxious about how their personal story will be recorded and used against them. We can immediately diffuse this tension by naming your institutional role, explaining who views case notes, and explicitly inviting questions up front. When we demystify agency record keeping, we instantly convert what felt like bureaucratic interrogation into a transparent partnership. That simple introductory step sets the baseline tone for safety and mutual respect throughout the entire therapeutic relationship. Updating outdated forms to create inclusive social work forms is essential because binary checkboxes frequently erase marginalized identity experiences. Implementing a gender-affirming intake form with open text fields for self-identified pronouns and those names completely changes a client's comfort level before you get to speak with them. Beyond gender identity, we must also replace pathologizing clinical jargons with strength-affirming language that honors how clients define their own family structures. Small paper tweaks send massive signals about whether your agency is truly a safe harbor. A trauma-informed seating layout eliminates physical barriers with massive mahogany desks separating work and client. In a client-centered practice environment, chairs should be arranged at gentle 45-degree angles so eye contact feels natural rather than confrontational. It is equally critical to position seating so clients maintain a clear line of sight to exit doors, preserving their psychological sense of safety and physical autonomy. If you're typing notes on a computer screen, turn the monitor sideways so your client can comfortably view what you are documenting in real time. Visual transparency in physical and digital layouts prevents clients from feeling observed or judged behind closed doors. Mastering reframing clinical questions shifts our focus away from individual deficits towards environmental realities. For instance, asking a client why he had missed 3 employment interviews, which instinctively put him on defense. When the reframed prompt to conduct a true systematic barrier assessment by asking what transit or childcare hurdles stood in their path, the client finds themselves opening up about local bus route cancellations and rising childcare costs. That simple shift instantly validated their frustration and highlighted his incredible resilience in navigating institutional red tape. When we frame challenges as responses to systemic breakdowns rather than personal flaws, client engagement doubles. Explicitly naming structural racism in healthcare and housing validates that client distress is frequently a rational response to systemic oppression. Utilizing a comprehensive person in environment approach means evaluating housing discrimination, wage disparities, and institutional bias alongside emotional health. When we normalize conversations about economic equality, sexism, and ableism, clients no longer feel forced to carry personal shame for societal systemic failures. Be sure to document these environmental hurdles clearly in your official case narrative so partner agencies understand the complete picture. This prevents misattributing environmental survival strategies solely to individual psychological pathology. Effective co created care planning positions the client as an undisputed primary expert in their own life journey and recovery. When establishing collaborative social work goals, formulate objective milestones directly from the client's stated priorities rather than boilerplate agency templates. Offer flexible choices regarding appointment frequencies, check in channels, and community support options to fit their actual daily living reality. Schedule regular check ins to revisit and adjust these goals as new challenges or personal aspirations naturally emerge. When clients hold the pen on their service plans, follow through and long term outcomes improve dramatically. Implementing continuous informed consent means treating consent as an ongoing rationale dialogue rather than a single signature collected at intake. Honoring client autonomy in therapy requires explicitly reminding clients that they have the right to pause or skip any sensitive questions without risking their access to service. Before sharing diagnostic reports or intake summaries with external agencies, pause to review the exact details being transmitted and confirm client permission. Periodically check in during longer assessment sessions to monitor energy levels and emotional comfort. This practice reinforces that your client maintains ownership of their personal story at every single stage. Engaging in reflective social work practice is an ongoing ethical commitment to identifying and unlearning our own privilege and assumptions. Unpacking implicit bias in casework requires reserving 5 minutes after every client intake to journal about personal reactions and potential blind spots. Bringing these reflections into regular peer supervision sessions to explore how cultural dynamics and agency pressures influence your clinical instincts. Actively seek out anonymous feedback from the community members you serve to evaluate how intake procedures feel from their perspective. Continuous self scrutiny ensures our practices stay grounded in humility, growth, and genuine accountability. To wrap up our core framework, implementing an anti oppressive social work framework comes down to 5 high impact operational habits. First, disclose power dynamics and agency context during your initial greeting. Second, audit intake paperwork to remove binary or deficit based phrasing. Third, reframe diagnostic questions around systemic obstacles. Fourth, co author action plans directly with clients as equal partners. Finally, embed equity focused assessment steps into your daily workflow through continuous informed consent and routine post session self reflection. Applying these 5 principles systematically will elevate client trust and transform your agency's culture. Modernizing your agency paperwork with dedicated social work case management software makes delivering inclusive care seamless and standardized. With Case Management Hub, you can easily build customized, HIPAA compliant digital intake forms with open gender fields, strength based prompts, and built in continuous consent tracking. It streamlines documentation time while ensuring your entire clinical team maintains equity driven standards across every client interaction. If you're ready to save hours of administrative paperwork while enhancing client engagement, click the link in the description box below and start your free 21-day trial today and see the difference in your practice. Thank you so much for taking the time to invest in your clinical practice and support equity-driven care in our communities. For more actionable tools, templates, and continuing education for social workers, make sure to hit the subscribe button and turn on notifications. If you found this guide helpful, share it with a colleague or supervisor in your agency network. Together, we can build a more compassionate, trauma-informed, and liberating human service system. Once you click the link, you'll be brought to this page. Just enter your first name, last name, and email, as well as your organization name, and select your practice area. We also recommend that you enter a phone number. Let's take a look at how easy it is to create, edit, and send a form in Case Management Hub. Step 1, from the sidebar, click the Forms module and search for Basic Intake Form, and then click the title to open it. Here's a tip. Forms with a padlock are master templates provided by Case Management Hub to help you get started. You can easily customize these to make them your own. Step 2, click Edit Template to start customizing the form to your needs. Here's a tip. You can add new form fields using the right sidebar. Just drag them straight into your form. Once done, click Save. Step 3, select a client to start filling out a form on their behalf. No need to retype your client's data. It magically fills in the form for you, saving you time. Step 4, or to send the form directly to a client or clients, click Send Form, select the clients, and then click Send. Tip: you can send forms to a client that are not yet on Case Management Hub, or what we call external recipients, by clicking Add Recipient and filling out their email, first name, and last name. Step 5. Create a public link for your form so you can easily share it with anyone. Just click Copy Link to publish your online form. A link will automatically be created for you, but you can always edit this and other form settings even after creating the online form. To do this, just click on the gear icon in the top right corner of the form page to bring up the form settings. And don't forget to like this video, as it lets me know that you've received value from it. You can also subscribe to the channel so you don't miss great content like this one.